I work at a local hospital. Let's call, hold on just for a second. I got some message here. All right. So I work at a local hospital here in Mansfield. It's Methodist Mansfield Medical Center. I've known Marcus for several years now, as he went to school with my kiddos at the same high school.
Awesome. All right, thank you. Does someone want to start the questions?
I could ask the first one. Okay. So what has been the best or most rewarding part about your career?
The most rewarding part and the best part is really the ability and the opportunity to be able to help people in their time of need. Every day we see people who are oftentimes at the worst day of their life. When they have to go into an ER, not all the time. Not everything we see is true emergency, but every day we run into people that are really having true emergency and life or death or life altering event.
All right, I can go next. So throughout your career, like, what have you learned along the way?
I think along the way, what I've learned is that emergency to me is different than emergency to other people. Being in the field and dealing with this every day. My family will oftentimes make fun of me because they think that unless the arm's falling off, I really don't consider it an emergency from my perspective. And that's somewhat true. I mean, that's a little bit far-fetched, obviously exaggerated, but oftentimes to me I look at things emergencies a little differently than what other people look at, how other people look at emergencies. For example, my son was playing baseball and he ran full speed to try to catch the ball, and I guess that on the field they're supposed to have warning track to tell you that you're at the end of the field. Well, this one particular field had no warning track, so he by the time he turned around to see how far he was already at the fence, and he smashed his face right into the fence. Blood coming out of his nose was swollen. And my wife calls me, in a panic. What should I do? Should I go to the ER? He doesn't look good. And I said, well, I'm on my way home. Why don't you bring him home and we'll see. And so he comes home, and yeah, I mean, he's got blood everywhere, it's swollen nose. And I knew, I was going to schedule him for a CAT scan the next day. I called one of my colleagues who's an ENT doctor who was going to see him the next day. And his sister's like, well, don't you need to take him to the ER? And I'm like, no, So I look at things differently. I can imagine that anybody else would immediately say, okay, that's a true emergency. Let's go to the hospital. So I have the benefit of looking at emergencies differently. And I think that that gives me a good perspective. The other perspective that I also have learned along the way is that every day, cherish your life and people around you, because I see life-changing events almost every day. People say goodbye to their loved ones and either get into a bad wreck, have a heart attack, have some life-altering experience without any warning. So I see that people have said goodbye to their kids. In fact, I remember this one recent event where a father said bye to his children. His wife went to work. This guy was only 45 or something like that, pretty young guy. Went to work, and at work, he said, I'm not feeling well. I'm going to sit down. And that was his last breath. From there, he went to cardiac arrest and ended up dying. Of course, his family came in all distraught, had no clue that that was his last chance to be with him. So don't take life and people around you for granted. Any moment that can be taken away from you.
Okay, I think I'll ask the next question. What is a day in the life of your profession? Kind of like walk us through like when you get to work and then from there to when you leave work.
Sure. So I think first let's talk about the timing of my shifts. So we do shift work because ER is open 24/7. Somebody always has to be there. So we have morning shifts, afternoon shifts, evening shifts, and overnight shifts. Each week is a different schedule for me. So, for example, tonight, tomorrow night, and the following night, I'm doing overnight shifts. Then I'll have a day off, and then I'll switch into a morning shift or afternoon shift. So it's a rotating schedule. Each day is a different day. We have unscheduled visits, so you don't know what your shift's going to be like. It can be a very busy shift. It can be very slow shift. You can see a lot of mundane things, cough, cold, congestions, versus you can see a heart attack. So people just come in for unscheduled visits, for whatever they're considering it's their emergencies. And so people come in through either our front door, called the triage area, where you check in, or people come into ambulance bay via ambulance. It can be something as simple as a small cut, minor injuries, to life-threatening events, cardiac arrest, things like that. So each day is different. Each patient is different. Each chief complaint is different. Somebody has abdominal pain. They can have, maybe just some stomach upset, gastroenteritis, and things like that. While another person may be having ruptured aorta or kidney stone or kidney infection, appendicitis. So every chief complaint has lots of different variabilities of what it can be. We also treat from beginning of life to the end of life. We see everybody. So you have to be able to treat multitude of illnesses and multitude of ages. And no 2 days are similar, So I go in tonight, I could have a slow day, routine stuff, and tomorrow I could have a very busy day, lots of sick patients. Every day is different.
All right, awesome. Thank you.
You're welcome.
I have a question.
Sure.
Who or what influenced you to become a doctor?
So, some people know from when they're little what they want to be. Some people know that, hey, I'm going to be a brain surgeon, or I'm going to be this, or I'm going to be that. For me, that wasn't the case. I kind of found my way along the way. Graduating high school, I wanted to be in the military, so that's what I did. I went into Air Force. Along the way, I talked to several physician assistants and nurse practitioners, and kind of figured out what they did. I also had some physician friends and relatives. My sister was in medical school as well. So kind of slowly I got interested in biology, anatomy, physiology, and those kind of things. And I slowly found my way along the way. I think part of it was, a big part of it was, when I was switched over from active duty into reserves, my physician that I worked with was a good friend of mine, became a good friend of mine, and he advised me quite a bit about what it was like to be a physician, to go through training and things like that. So I think that he played a big part in me going through this.
That's awesome. Thank you.
You're welcome.
I have a, this isn't
yep.
like my main question, but sorry, Yang. I wanted, like, are you gonna take a nap after this, or are you just gonna like be up all day?
So first days are always a little tricky. The first day of the night shift, string of night shift, is always tricky because I slept very well last night. So I'm not, very sleepy, but if I don't take a nap beforehand, I know that comes 11 o'clock, 12 o'clock, 1 o'clock in the morning, I'll start getting a little tired. So I'll probably catch a quick, couple hour nap before I go in.
Okay.
And then tomorrow,
Okay.
when I get off the shift, I'll shower, eat a little bit, and then hopefully catch about 5-6 hours in that sleep, not nap, but
Wow.
sleep. My problem is that after an overnight shift, I usually cannot sleep more than 4 or 5 hours, whether I set an alarm or not set an alarm or whatever I do. By 4 or 5 hours, I'm wide awake at that point. If I do multiple night shifts in a row, then by the third or fourth shift, then I really start getting tired, because then I need to catch up on that full sleep.
Yeah, you can have the next question. That was good. Thank you.
Yeah,
You're
thank you.
welcome.
Adding on to Katrina's question, were there any difficulties along, or were there any difficulties like reaching your career?
Yeah, I mean, it's I think just about any profession you go into, there are going to be challenges, because this is one of those things that, unless you're dedicated and know what you're getting into, a lot of people figure out along the way that this is not for them. This is something that you have to be dedicated to. It's long hours while in school. It's long hours while in training. And even now, there's a lot of conferences and CMEs and, continuing education that you have to keep up with, a lot of requirements to continue your licensing that you have to keep up with. So it's not easy, lots of challenges along the way, but if it's something you like, then it's not that much. It doesn't seem like work. When you're reading something you like, you enjoy, then it doesn't feel that bad. Or even at work, when you're doing residencies, there are a lot of long hours they have to pull through, and a lot of on-call duties and things like that. Again, if you're doing things that you like, then it doesn't seem as bad.
Awesome. I think I'll ask the next question. So, kind of talking about the difficulties, how do you balance life and work in your profession?
So very good question. You know, you got to have a good balance of life and work, a mixture, because otherwise what happens is people start getting burnt out. You know, that's the new terminology I'm hearing more and more every day. And for some reason, the younger generation, I'm hearing it more than my generation. You know, I've been doing this almost now for 15, 18 years. I do almost, let's say, 17, 18 shifts on my regular ER. Then I do additional work at other ERs, you know, and the way to prevent from getting burnt out is when I'm off, when I'm home, I do home things. I do things that I enjoy. You know, things like this I enjoy. You know, I enjoy um, teaching or talking about my experience to other people. I do sometimes. I go to elementary schools and high schools and talk to people. I used to do a lot more of that beforehand. I've slowed down a little bit now, but I like to take care of things around the house. I have dogs, as Marcus knows. We have chickens. You know, we just do a lot of family things, a lot of outings we go to with family. So when I'm off, I'm with family and doing things that I enjoy. So you have to balance. Otherwise, I think a lot of people get burnt out because they don't know how to shut things off, how to shut the work off, and then enjoy when you're home.
Yeah, kind of a follow-up question. Do you ever go on a call, or is that part of
Yeah,
your-
so my field is typical is unique in a physician field that I don't have call per se. So when I'm off, I'm off. When you have private practice, you often have to take calls. If you're a cardiologist, if you're a GI doctor, if you have a internal medicine practice, then you have to be on call for your patients. Well, ER, I'm on duty when I'm there. I see patients. When I go home, I'm done. Now, that said, every so often, once a month or so, we take a call, like a backup call. So somebody calls out sick, then I have to go in. But that rarely happens. The other thing is I'm also EMS medical director. So because of that particular role, I'm on call 24/7. So I have several cities that I oversee from the EMS standpoint, so they can call me 24/7. Doesn't matter if I just got home from shift and I just slept, I can be woken up and they can call me for any advice they need while they're out there treating patients.
Thank you.
You're welcome.
So my question is, what was the hardest choice you've ever made so far in your profession?
The hardest choice, it's hard to pick which choice you know is hard to make. There are a lot of tough decisions you have to make. More than that, there are a lot of risky decisions you have to make. As an emergency physician, you can't do everything for everybody. You know, somebody comes in for chest pain, I can't have A to Z that I'm going to do on them. You have to um, figure out from your experience, your knowledge, from the way they present, the patients are presenting, what you're going to do for them to figure out what's wrong with them and what's not wrong with them. And I think the scariest part is when you discharge somebody home. Sometimes it keeps me awake at night knowing, did I make the right decision? Did I send the patient home? Admitting patient that necessarily doesn't need admission is okay. At least they're going to be in the hospital, they're going to be watched. But when you discharge a patient home, that's always a little scary. That is there a chance that I may have missed something? So those decisions are tough to make when you're sending somebody home, knowing that there's a possibility they could be wrong. And we're humans. We can make a mistake, and you have to be very careful with that.
That makes sense. Thank you.
Yep.
Okay, I have one more question.
Sure.
So, what is something you know now that you wish you knew like before your medical journey began?
Um, so I think that what I would do differently is my high school. So going through high school, I really did not have any direction. You know, I was an immigrant. I came when I was 10. So going through, my parents were very busy trying to make sure there's food on the table, making sure we have shelter. So I kind of grew up without great guidance as far as the career goes. You know, my parents were from India. None of them are well, neither one of them are in medical field. They didn't know how to guide me. So I kind of found my way along the way. I think knowing now, going back, I would have probably tried to make my life easier by making sure I set myself up properly as far as taking the correct courses and taking, taking, I guess, schoolwork and coursework more seriously back then. I think the other thing also, if you guys are in a unique position to look out for those things, is mission trips, that go elsewhere to help people, church camps and things like that, or even your local clinics sometimes will have open house where they visit either patients or they take blood pressure checks and stuff like that. I think any exposure you can get to taking care of patients will be very, very helpful.
Thank you.
Yeah.
All right, I have another question too. Oh, I'm sorry.
Sure.
So what advice do you have for students seeking work in the same field as you?
So for students who are seeking the same field? So what I would say is, just as I said, that try to get as much exposure as possible in the field. You just, one is that you're going to get the benefit of the exposure to the field, so you kind of know what you're getting into. But secondly, networking is huge benefit. You just never know who you're going to talk to, where you're going to talk to. They're going to connect the links for you or help you connect the links and get you where you're going to be. Right now, looking back, a lot of this is luck, but a lot of this is just being in the right place at the right time and talking to the right people that have helped me get here. For example, when I got out of active duty, I knew I wanted to go into healthcare. I just didn't know what. So I started volunteering at a local emergency room. And I then said, okay, well, it'd be kind of cool to get some experience in the EMS. So I called the EMS department and said, hey, can I do some ride-alongs with you guys? I just want to get some hours and experience. So they said, sure. Well, the paramedic I worked with just turned out that he was a phlebotomist. So while on duty, he worked as a paramedic, but when he was off duty, he worked with a local blood bank as a phlebotomist. And what they do is they do these blood drives at different locations. So the company was New York City Blood Center, and they would do blood drives at various locations. And his job was to go with the department and draw blood, from different people, donors that are donating blood. And so he talked to me about it, and I said, well, I have no experience. I would love to do that, but I have no experience. And it just turns out that he put in a good word for me. My interview with the department went well, and I got hired as a phlebotomist with no experience. So you just never know. When you talk to the right people, sometimes things just work out. If I hadn't been in an emergency room, if I hadn't asked for the EMS, that would have never happened. And I'm sure that was a big part of the reason I got into medical school, is the exposure I got, the experience I got. Just one step brings you to the next step, brings you to the next step. Looking forward, you may not see it, but when you look back, you say, this is why this happened. This is who I talked to, why this happened. So a lot of links kind of come together when you look back, and in the present time, you may not realize the value of all this exposure.
Thank you.
Yeah.
Yeah, so I have one more question. So did you start your medicine journey in Mansfield, or did you start somewhere else and kind of move around the country, or what was kind of your path, I guess, with medicine?
Yeah, so my path was with medicine. I started in Chicago Medical School. So that was my medical school that I graduated from. From there, I went to Yale New Haven Hospital in Connecticut. From there, I came straight to Methodist Mansfield, where I've been since then. So my real work, I guess, the way we call it, is attending physician. So my attending physician job was with Methodist Mansfield, and I've stayed here since then.
Thank you. I guess it's been a long time so far.
Yeah, the way it looks, I'm probably going to end up retiring here.
All right, guys, do we have any other questions for Dr. Trivedi?
I have one final question.
Sure.
And are you happy with the choices you've made so far in terms of
Yeah,
the path?
so that's one thing that you have to think about, and that's what this exposure will help you also to see if it's a right place for you. Like I was saying earlier, a lot of people are getting burnt out. A lot of the youngsters, I would say, are coming in, and within 2 years, 3 years, 5 years, they're looking for something else to do. They're getting super burnt out, super stressed. Me looking back, I couldn't think of doing anything else. There are times that there are days I go in and I go home and I'm like, oh my God, this is a bad day. And taking care of emergencies, I love. This is why I went into this, but it's the pain seekers you have to deal with, It's a substance abuse you have to deal with. It's a socioeconomic issues you have to deal with. It's oftentimes the people that have non-emergent complaints that take most of your time, because you know that they don't need to be there. You know that they don't need admission, yet they're convinced they have some emergency going on. You know, for example, they're having abdominal pain for 10 years, and now tonight is an emergency for them. And it's frustrating when everything comes back negative. It's a long discussion with the patients and can take a lot of your energy and time when you actually need to attend to other more emergent issues also. So those can be stressful. But I think in any field you go into, there are going to be pluses and minuses, and I think that the pluses far outweigh the minuses of my career, and I don't think I would enjoy doing anything else. So yeah, I'm happy where I am today.
I'm so glad to hear that. Thank you.
All right. Yeah, thank you again so much for coming on the call with us, talking to us about your career, about your journey here. Yeah, and we'll let you know when the video is posted. And
All right.
Thank you so much for helping us out with this project.
You're quite welcome. Good luck to everybody.
Thank you, doctor.
All right.
Thank
Thank you,
you.
doctor.
Bye, guys.
Bye.